Community posting in the time of COVID-19 pandemic. The community posting in the University of Malaya has started since 1967. It was designed to allow our medical students to be exposed to the healthcare system in the country and to allow them to understand health issues faced by communities, particularly in the rural communities. Since at the time, 73% of Malaysians live in rural areas. The program was divided into two parts, the Rural Health Survey, RHS, and the Organisation and Management of Health Services, OMHS. As part of the community posting, the medical student is attached to a district health office. They will be exposed to various activities conducted by healthcare workers at the health district. The student will be assigned to a village where they will conduct health survey and community project. Besides that, the student is also exposed to various health issues faced by these communities. They also participate in visits to various areas to understand the delivery of public health. This includes worksite and environmental health related sites. As the country continues to develop, more and more people are moving to urban area. The community posting program has also shifted its focus from rural to urban area. As we understand, the health issue faced by urban poor is equally important. With the establishment of the UMA program, the two parts was combined to a single community posting. These are the learning outcomes of the community posting. The community posting was scheduled to take place between 18 May and 17 July 2020. However, on 16 March 2020, the government of Malaysia declared Movement Control Order or MCO, which lasted from 18 March to 3 May 2020. It was replaced with the Conditional Movement Control Order from 4th May to 9th June 2020 and followed with the Recovery MCO from 10 June 2020 to 31st March 2021. At the time of the announcement of the first MCO, the faculty members in the department immediately developed an alternative plan for the community posting. The basis of the plan was that the student would not be able to go to the district for the posting. The first thing we did was to review the learning outcome of the program. The department then came out with new learning outcome, an innovative way to ensure that the student get the full experience of the community posting. One of the learning outcome, LO5, plan and implement appropriate public health intervention through community activities, was not achievable due to the MCO. We removed the LO and replaced it with two new LOs. LO6, understand public health crisis management, example pandemic, at various healthcare levels, including the district, health office, and at tertiary hospitals. And LO7, discuss the wide-ranging effect of public health crisis on families, communities, and the environment. Having new LOs is not adequate. We also modify some of the activities to ensure that the student is able to achieve the LOs without having to go to the district or the communities. For example, Objective 1, no changes was needed, as the LO, understand the principles in disease prevention and improve population health can be delivered using lectures alone. For LO2, understand the contribution of family, community, and environment to health, where the student needs to engage with the communities. The activities was changed to lecture and case-based learning. For Objective 3, or Learning Outcome 3, understand the roles and functions of various entities within the healthcare system in relation to the communities. The original plan was for the students to interview the personnel at the district health office to understand their roles and functions. It was replaced by an online presentation with an interview instead of face-to-face encounter. For LO4, determine the health issues in the community. The original plan was for the students need to conduct a community survey to understand the needs of the community. Instead, the student is asked to conduct a situation analysis based on the discussion and information they obtain from the district health office and to understand the needs of the community based on this information. For LO5, which is to demonstrate communication and community engagement skill. The original plan was for the students to have community engagement by developing community health campaign. The student was to conduct the community health campaign, which usually consists of health screening program. Instead, the student was asked to come up with communication strategies and develop communication materials. The materials can be in the form of poster, pamphlet, videos, or write up to the local media. For learning outcome 6, which is a new objective, understand public health crisis management at various healthcare levels, including at the district health office and at tertiary hospital. The students are required to interview the medical officer of health of the district to understand the strategies that the MOH use to manage COVID-19 crisis at the district. LO7 is also new. It is to discuss the wide-ranging effect of public health crisis on families, communities, and the environment. This was delivered using case-based learning. We use lectures, situation analysis and planning for community projects, online interview and discussion with district health officer personnel or healthcare workers, case-based learning and communication materials to help us in delivering the community posting program. Here are the case-based learning that we have developed. They include community engagement in public health, sustainable environmental development, occupational health study, social determinants of adolescent maternal health, mental health issue in community and good mental health, nutritional issue during movement control order, the story of Kam Agong, a maternal health issue, social determinants of elderly health, non-communicable disease management in the time of pandemic, access to care and services for HIV patients during MCO, economic and health impact of MCO on low-income families, and risk management issue during the COVID-19 pandemic. Our students also developed several communication materials, which includes posters, videos, and also articles that were submitted to local newspapers. They include how resilient is our food system at the times of pandemic, and vaccination as a possible solution to the COVID-19 pandemic, which was submitted to and published in Malaysian Medical Gazette. Online learning among undergraduates, challenges and suggestions for optimum health was published in Sinchiu. Workplace violence, time to heal our healers, in Code Blue. Medical frontliners deserve better, the New Straits Times, and adjusting to life after lockdown, citizens' power in preventing a new wave of COVID-19 in the Malay Mail. In the time of crisis is where innovation and opportunity arise. With innovation learning, we can continue in the time of adversity. Thank you.